You could react to this news from Merck about their antiviral pill that cuts the risk of death and hospitalization by COVID.
The news of the efficacy of this particular antiviral is obviously very good news. The company, when they briefed us last night, had mentioned that they will be submitting their data to the FDA imminently. The data are impressive. There was a 50% diminution. Of importance is that in the placebo group, there were 8 deaths, and in the treatment group, there were no deaths. That's also very important and very good news. We always hesitate to make any timelines. The FDA will look at the data and in their usual very efficient and effective way, will examine the data as quickly as they possibly can, and then it will be taken from there, because once a recommendation is made, then we go through the same process of getting the recommendation for its usage through the CDC.
Beginning of his administration, the president has been clear.
One of the many reasons that I'm hopeful about the future of our pandemic response is that vaccines for children under 12 are now on the horizon.
The White House has repeatedly said the CDC is responsible.
Let's begin with an overview of the data. Today, our 7-day average of cases is about 106,400 cases per day, and the 7-day average of hospital admissions is about 8,300 per day. Both of these are about a 15% decrease from last week. 7-day average daily deaths are at 1,476 per day. You've heard me say it before. Vaccines are the most powerful tool we have to prevent COVID-19 infections, hospitalizations, and death.
Communities and employers.
Deaths remain substantially higher in states with low vaccine coverage.
And we're actually on track now to double the number of rapid tests in the market over the next 60 days. We've also worked with top.
What we know is it does seem to have an impact on the clinical course of COVID-19. It seems to reduce the if you take it for a treatment course early on in the course of the illness, once you start to get sick, it could reduce the likelihood that you'll go to the hospital, but it's no guarantee. And so there's a lot of attractive features about it, just like there is for Tamiflu for influenza, which is another way to think about this. As I think somebody mentioned once, it was like Tamiflu for COVID. And we know how that works. It does reduce the severity of illness, but doesn't prevent it entirely. But it can potentially keep a lot of people out of the hospital.